Hello, my name is Madison Dressler, and I will be talking about gene therapy here today. I'm going to be giving an introduction to this very interesting science that we learned about pretty recently in this class. I'll be giving a couple examples of some therapies and some insight into the ethical concerns surrounding it. So, gene therapy is a recently achieved technique that uses genes to treat, prevent, or cure a disease or disorder. It all started in 1990 for treatment of a 4-year-old girl with adenosine deaminase deficiency, or ADA. So, scientists used a disabled virus to deliver a working copy of the ADA gene into her own blood cells. This was temporarily successful, and it is regarded as the start of gene therapy. Since then, gene therapy has exploded into a revolution of medicine. Gene therapy can work by replacement, edit, addition, or inactivation of a gene. Gene replacement is where the disease-causing gene is replaced with a healthy copy of the gene. Gene editing is where they alter or edit the DNA that is already in the cells. Gene addition is when a functional copy of a gene is inserted inside of a cell. And finally, gene inactivation is when a mutated gene is disabled and stops it from making changes within the body. So, how do they do this to people? How is it administered? Gene therapy is administered either ex vivo or in vivo. As you can see in this image to the left, in vivo is when a vector carrying a gene is injected into a body. Nothing happens outside of the body, everything happens using these vectors to deliver a gene. Alright, ex vivo is when cells are removed from the body, then are modified in a lab, then returned to the patient's body. So this gene modification will happen outside of the body and is then put back into the body. This is either through a lentivirus or CRISPR. Gene therapy is used to treat diseases that have limited options or diseases that only have treatments that can help with symptoms. This is countless diseases right now. Many diseases don't have any known cure. They only just have things that can help manage symptoms for a lot of people. So far, there are many success stories with gene therapy, but there have been some faults with it, including allergic reaction. Some cancers have happened, organ damage has happened. Cancer and organ damage leads to a black box warning put on the drug. One of the drugs I'm talking about today actually has a black box warning. Gene therapy itself is very expensive to administer and study, as you can imagine. All of these advanced technologies are pretty pricey. So there are many ethical concerns to be considered when dealing with the alteration of genes, and therefore many regulations have been put into place. So let's dive deeper into these ethical concerns, because this is a very big setback of gene therapies as it goes against some societal expectations of science. So the con of ethical concerns for gene therapy is kind of showcased by the 1997 film Gattaca. This is set in a future where society is made of designer babies and quote-unquote invalids. These designer babies are genetically made to be perfect individuals and are seen as the best of the best, whereas the naturally born invalids are useless. So these designer babies are basically test tube babies where the parents picked and choose genetic traits for the fetus to have. And this kind of became a setback in the movie. Y'all should watch it. It's very good. It has a lot of science in it, and it shows a very real fear, kind of like the movie Terminator, of how technology can impact us. So going back to what I was saying, designer babies are a real fear for people, as this is not a therapeutic way to treat people and is rightfully seen as very unethical. Gene therapy has also been shown to have unintended genetic changes and can cause cancer in some individuals. Since gene therapy is still a new treatment, there has been no long-term and germline consequences observed so far in studies. These scary concerns are the reason why safety regulations are so important. So, who is in charge of these safety regulations? The Food and Drug Administration is responsible for the safety regulations. They are well known for this, but they have very strict protocols when approving clinical trials and medicinal methods. There are 500 plus approved clinical trials ongoing dealing with gene therapy. As of this year, there are currently 46 approved gene therapies for a variety of diseases or disorders. These protocols are especially important when dealing with the risk of human life as we are here with gene therapy. This is why there are so many phases, different steps to being approved by the FDA. Each of these phases, as shown in this image on the right, has very strict criteria that people have to meet. And since it is technically an experiment and technically a human experiment, everyone must be a volunteer. So let's dive into some examples of gene therapy. I decided to focus on gene therapy for blood disorders, since blood disorders are relatively common, but they are not often discussed. The first disorder is called Hemophilia B, which is an inherited blood disorder caused by a gene variant that leads to a deficiency of the clotting factor number 9. This gene deficiency leads to prolonged bleeding or internal bleeding into joints, muscles, or organs, as the clotting factor is part of how the blood coagulates. So you can imagine having constant random bleeding in your body. It can be very painful and it can cause a lot of issues. Treatment for this disease include repeated blood transfusions, medications, physical therapy, and even surgery to repair damaged tissues. In 2022, the FDA approved HEMGENIX to treat this disorder. It is an adeno-associated virus-based gene therapy given one time for the treatment of adults with hemophilia B. It uses a vector to deliver in vivo a new working gene that is able to deliver factor 9 when needed. So this would be an example of gene addition therapy, like what I was talking about before. This is given once through an IV and makes it so that these patients have less pain, spend less time in the hospital, and do not need repeated blood transfusions. Another blood disorder called beta thalassemia happens when someone's body does not produce enough hemoglobin. There is a genetic mutation in the HBB gene that causes the beta globin chains to be malformed in the red blood cell. Treatments for this disease include blood infusions, iron overloads, and stem cell transplants. Iron overloads is when they give patients a ton of iron, basically, to try and get their body to create more hemoglobin. Zynteglo is a one-time ex vivo gene therapy that helps patients who are blood transfusion dependent. It puts functional copies of the faulty gene into the patient, so it works as gene replacement therapy. This can free patients who depend on red blood cell transfusions from a lot of hospital trips. A very well-known disorder called sickle cell disease just got 2 different FDA-approved drugs in 2023. Sickle cell affects around 7.74 million people worldwide and can cause a wide range of symptoms. This disease is caused by a faulty beta globin gene, which causes red blood cells to become stiff and take on a sickle shape, which can lead to severe pain known as vaso-occlusive events. As you can see in this image here on the right, the abnormally shaped blood cells are sickle-shaped, and they kind of block normal blood cells from getting where they need to go because they clump together like a bunch of hair in a drain where water just needs to pour into, but it can't because there's all this weird hair in the way. I hope that analogy helped. Okay, so the 2 approved gene therapies are Casgevy and Lyfgenia. Casgevy is an ex vivo treatment that uses CRISPR-Cas9 gene editing to modify a patient's own blood cells. LifeGenia is a one-time cell-based gene therapy that uses a lentiviral vector that modifies the hemoglobin itself. So these two therapies treat the same thing differently and come out with the same results. Results being help for people with sickle cell. So here is an infographic on Casgevy and the mechanism of action for the therapy. Stem cells will be extracted from the patient's bone marrow and brought to a lab where it will be altered. CRISPR-Cas9 will be used to edit the BCL11A gene, which is the faulty gene, so that it then can work correctly. These cells will then be put back into the patient where they can make healthy fetal hemoglobin cells. LifeGenia works through injection of a lentiviral gene that contains the missing gene into the body where it can produce proper red blood cells. This gene will edit the mutated beta globin gene by transducing onto other cells. So basically, this gene therapy works as kind of a nice, fantastic vampire, which will leach itself onto the bad red blood cells and pour the good gene into it. And then it will turn the bad blood cells into good blood cells. So they will be making healthy fetal hemoglobin cells. And they will be well-working cells. So these two therapies work in different ways to treat people differently, allowing these millions of people to different options of treatment. I thought it would be interesting to include a disease that had two gene therapies right now, because that shows how many more options people get from gene therapy. So, tying it all together, gene therapy is the future of medicine. There are 500 plus approved clinical trials in motion where millions of people will be helped. The FDA projects that 10 to 20 more therapies will be approved next year to add to the current 49 studies. A total of 2,809 studies on gene therapies will be processed by the end of the year by the FDA, including treatments for heart disease, diabetes, and cancer. So, a total of around 100,000 people have gotten gene therapy this year alone, where they have been cured or treated by it. Okay. Thank you so much for listening. My references are in the description below, and I also included a couple useful places for information. I hope you have a great day, and I hope you enjoyed learning about this in class as much as I did. Thank you.